I'm sitting with Dan Engle, and he's a psychiatrist, and I believe he's in California, but let's hear it from Dan where you are and where you work, Dan.
hmm I am, in fact, based in California right now, and most of the work that I do is actually by satellite, consulting with various clinics and organizations, as well as working with people across the country and across the world in their healing process.
Fabulous. And as I understand it, you're doing some consulting work with Crossroads Ibogaine, one clinic that's located in California and also works in Mexico. Could you tell us a little bit about your position there as a consultant?
Yes, Crossroads is an Ibogaine center. They're primarily located in Mexico,
Hmm.
and I've been the medical consultant with them for going on a couple of years now.
Okay. And as a consultant, are you consulting the administration, or you consult particular clients who go there, or how does it
Both.
work? Hmm.
Both of its programmatic support, administrative support, and then to be able to discuss any situations that arise, what's working, what's not working, maximizing the outcomes.
Okay, great. Now, speaking about outcome, would you just give us a thumbnail sketch right now about the kind of outcomes they have there? Because I know they're working with ibogaine and other plant-based or natural-based. Um, I hesitate to call it medication, but
Medicine.
healing medicines. Okay, well, we'll go
Yeah.
for that. And I know that it's pretty new program, and everything I've seen about it is really exemplary. But could you tell us the results people get? Like if they have a addiction, either alcohol, heroin, opiates, some of the things that people are dealing with now. What kind of outcomes do they get at Crossroads Ibogaine?
It's a good question, and I can break it down into patterns. Primarily, Ibogaine is a medicine that people come to in regards to supporting addiction recovery. I would say 90% of the clients that we work with are specifically coming for addiction support.
Mm.
10% are coming for personal and psychospiritual development.
Mm.
So if we're looking at the arena of addiction recovery, it's really important to talk about the whole process. So what Ibogaine does is it interrupts the addictive neurochemistry, and it essentially reboots somebody's internal hard drive back to a non-addictive state. And then it becomes increasingly important to do the integration work on the other side. Because if somebody has a rebooted hard drive and they go back into the previous environment, they're going to fall prey to their old triggers, their old lifestyle patterns, get back into old habits, relapse, and essentially be a potentially square one. Although, when you go through any kind of personal development program, you're never going right back to where you started
Hmm.
initially. So when we're looking at the benefit and the consistency of integration support, recovery coaching support, the treatment success numbers are 5 to 6 times that of traditional rehabilitation numbers.
Wow, that's impressive. And what would
Yeah.
you say is,
So, for
uh,
example, heroin treatment, it kind of depends on the numbers and the settings that you're looking at, but might be anywhere from 10% to 15% effective in the standard of care rehab model. And with Ibogaine, the numbers get closer to 65 to 70%.
wow, that's just stunning. You
Yeah.
know what I'm going to do? I'm going to say thank you for that intro, and I can't wait to interview you longer and to get into this further, and especially around outcomes for alcohol, heroin, and opiates, because you likely know in Vermont there's a big opiate problem. So,
Huge.
yes. So I want to thank you right now for this brief intro, and I'll come back to you in a moment.
Okay, great.